Okay. And good afternoon and welcome, everybody. My name is Dr. Nina Bailey, and I am nutrition scientist here at Igennus Healthcare Nutrition, and we are the host of today's webinar. I'm just going to make sure that everybody all our attendees are here. Okay. Right, I have my attendees. Right, so good afternoon and welcome. My name is Dr. Nina Bailey. I'm the nutrition scientist here at Igennus Healthcare Nutrition, and we'll be the host for today's webinar. With me are Dr. Robin Pauc of the Tinsley House Clinic in Hampshire. Hello, Robin.
Hello, can you hear me?
Hello, Robin. Excellent, yes, we can. And also with me today is Professor Basant Puri from Hammersmith Hospital, London. Hello, Basant.
Good afternoon.
Okay, right. So there is increasing concern that many GPs are prescribing medications with known side effects and without considering the fact that they may be safer, effective alternatives. Not only has the demand for information on alternatives increased, but many parents and sufferers themselves are frequently unaware that there are alternatives to many of the conventional drug-based therapies. And as such, Igennus have launched this series of educational webinars that are aimed at parents, teachers, healthcare providers, and sufferers themselves. Over the course of the webinars, we hope to provide information on causes and treatments relating to neurodevelopmental disorders, as well as share the results of our latest study highlighting the benefits of the omega-3 fatty acid EPA in the treatment of children diagnosed with and resistant to methylphenidate. Now, before I hand over to our first speaker, Dr. Robin Pauc, I'd just like to say that there will be an open session at the end of the webinar in which you'll be invited to ask questions. In the bottom left-hand corner of your screen, you'll see a chat box. You're very welcome to type your questions in as and when you feel like it. We will address those questions of the webinar. So I'm going to hand you straight over to Robin Pauc, and as an expert in child neurology, Dr. Pauc's interests lie in the mechanisms that control fetal and postnatal brain development and how it relates to developmental delay. His treatments are completely holistic, and today he's going to share with us some of the causes and treatments relating to ADHD, dyslexia and dyspraxia. And so, Robin, I'm handing over to you.
Thank you very much. Good afternoon. I have just a few minutes in which to tell you about the postnatal development of the brain, a little bit about what happens, what can go wrong and why, and what you can do about it. Until fairly recently, it was assumed that at birth the brain was pretty well complete, just needing to bulk up a little bit to reach its adult size. After all, the chimpanzee, our nearest relative, achieves this round about 7 months. Now we know a lot more about the postnatal development of the brain, thanks to people like Esther Nimchinsky, John Allman, Bud Craig, and Patrick Hoff. The brain continues to grow at a rapid growth rate long after birth. And on the slide that should have popped up on your screen, you can see the amazing change that takes place in the brain between the term and 4 years. In fact, it continues to grow and develop at a rapid rate until around 16 years of age. Between 16 and 19, it gets pruned back. The old adage, use it or lose it. And then it continues to grow and reach its final state of development round about 25 years of age. Now, between 4 months and 4 years, a second generation of brain cells develops. They develop, they have to travel to the location where they're going to live, they migrate, and then they have to connect with existing cells. They have to do this in order to survive. If they don't make friends, they can't survive. So it's essential that they reach their destination and then make a synaptic connection with other neurons. Now, the most studied
Okay,
of these
Robin, I'm just
brain
going to
cells,
interrupt you there, and you're fading in and out slightly there, Robin. I don't know whether your connection's quite right or not, but you're fading in and out slightly.
Okay. Well, I've checked sound level and it seems to be fine. Can you hear me now?
Yep, you're okay at the moment, but we lost you just for a few seconds at one point.
Oh dear. Okay. Well, I'll continue and hope that the sound stays where it should be. You can hear me okay now, yeah?
Okay. I can hear you fine now.
All right. I'll continue. Okay. Now, in terms of this postnatal brain development, there's a critical window which occurs between 4 months and 4 years when this second generation of brain cells develops. They have to form, migrate, they have to move to where they're going to live, and they have to make connection with existing cells. They have to do this to survive. Those cells that don't make friends, don't make the connection, don't survive. Now, of these second generation cells, the one that's received the greatest amount of attention is the von Echinomo neuron. And this to date has been found in a limited number of species. It's been found in the great apes, in some whales, in some dolphins, and in elephants. Now, in the human brain, it is only found in 3 locations. What's very interesting is that at birth we have 15% of these cells, the other 85% developing in this window of development, 4 months to 4 years. But there are more of these brain cells on the right side of the brain, in the right cerebral hemisphere. Now, this initially sort of challenged people and made them think a little bit as why it would be on the right, because after all, things like language, the higher intellectual things, theory of music, tends to happen in the left side of the brain. So why would you want these in the right side? And it seems the reason is that the right side of the brain has to deal with anything that's new, anything that's happening, meeting a new environment or a new person. We have to make a rapid assessment. So these very fast transmitting neurons are essential for our survival, that we can read a situation very closely, carefully, and understand it. And that's why they're found more on the right than they are on the left. And this is what the little chaps look like. Interesting cells in their structure, but we won't go into that at this particular stage. So these mental growth spurts, when things change, that happens, very important times, are 4 weeks, 8 weeks, 11 weeks, 4 months, 8 months, 12 months, and years 2, 4, 7, 11, 15, and 19. But again, I'll stress this period of 4 months to 4 years is critical for our development as human beings. This is when we receive these new cells and they move to their locations. And these growth spurts, these changes in brain development, are thought to be associated with the acquisition of new skills. The acquisition of skills, but also the ability of our brain to deal with them. So we have to ask ourselves, what controls this postnatal development? In the womb, we have to develop ears, eyes, limbs at an appropriate time. There's no point getting to 8 months into the pregnancy and suddenly realizing you haven't got any legs. It all has to happen at a set time. And similarly, after birth, during this period, delayed period of development, there has to be something that controls it. And it would seem that this amazing postnatal development is controlled by a thing called the epigenome. Now, the epigenome has only recently been discovered. The whole science of epigenetics is very new. Now, basically, you can think of the epigenome as being rather like an internal clock. And it has the ability to turn on, turn off genes. Now, a lot of these genes are to do with our development, to control our development. And so the epigenome has to switch on genes, which in turn switch on other genes, which controls our postnatal development. But it's been suggested by quite a number of people now that the epigenome may be caused to glitch by stressors, things that stress the developing brain and cause it to just halt for a moment of time in its development. Now, a chap called John Orman in the States, along with a few other researchers, have suggested that stressors may be such things as maternal stress. There's been a lot of research that's been done into viral infections of mothers, particularly in the field of autism, fetal distress and birth interventions. I myself have looked at this, and if the child gets stuck in the birth canal, if the umbilical cord is round the child's neck and the child goes into fetal distress, if the child needs to be assisted with forceps, or in particular with a ventouse-assisted delivery, the probability of the child going on to having developmental issues increases significantly. Also, we have to look at diet. Our diet has changed quite dramatically. The advent of the supermarket, food produced in factories, food additives, E-numbers, bad E-numbers, artificial sweeteners. Also, the lack of omega in our diet. It's not just the lack of omega, but also the imbalance that can happen in terms of us having too little omega-3, too much omega-6. Now, 60% of the brain is made out of fat, and of that fat, 20% needs to be omega-3. Now, if the brain can't get what it needs, if it can't get the omega-3, it will take whatever it can. If there's an abundance of omega-6, if there are other fats, it will take that. Studies conducted notably in France have shown that if you have too much bad fat in your diet, your mental performance declines. So the average American diet provides more than 10 times the proper amount of omega-6. Most of us are literally getting too much of a good thing. And why is this? Because substances that contain omega-6 are found in the primary oils added to most processed foods, foods that are made in factories. And this is another reason why we need to limit our consumption of processed foods. And it's also found in the oils, vegetable oils, that you'll probably have in your own kitchen. So there's an abundance of it about. So let's look at the normal child. What is the normal child? Well, many children, as they go through childhood, will show signs of minor glitches in their development. And this is so common as to be considered as normal. So a child may struggle to read at first. They may go through a stage of being clumsy. They may be delayed in riding a bicycle. They may struggle to learn to dress themselves. They may have poor spatial awareness. Some children develop minor tics. They may blink, grimace. And this can go on for weeks or a few months. And then as the brain catches up with itself, it stops. That's normal. But what happens when things go wrong? When a child develops a problem, what we have to do is look at the big picture. And it's all too easy, and we can all be found guilty of this. We focus on the obvious. A child is struggling to read. Teacher picks up the fact that the child is struggling, and the question is asked, does this child have dyslexia? And the problem is that at the moment we have these pigeonholes that we try and put children into. And what we tend to do, because we're doing that, is we ignore other signs. What we need to do is look at this word at the bottom of the page, comorbidity. So comorbidity, in terms of the learning and behavioral disorders, means that these conditions never occur in isolation. They will always appear in patterns of comorbidity together. So dyslexia, dyspraxia, attention deficit will appear together. Dyspraxia is the most common comorbid symptom of any of the learning or behavioural disorders. So a child may be struggling to read, but what we have to do is look at the bigger picture. Do they also have aspects of dyspraxia? Are they also suffering from aspects of attention deficit, which could be visual or mental? Why is this important? Because it is my belief that dyslexia, dyspraxia, attention deficit disorder, attention deficit hyperactivity disorder, the tic disorders, Tourette's itself, obsessive compulsive disorder in children are symptoms. They are not conditions. Now, I know this is a little bit controversial. That's my personal belief. And I think it's important because if you can relate symptoms to specific areas of the brain, then treatment options become available. So what we're saying is that these are symptoms that will always appear together in patterns that are unique to the individual child. So a child may have 40% dyslexia, if we have to quantify it, 35% dyspraxia, 25% attention deficit. Or a child may have 20% dyslexia, 60% dyspraxia, etc., etc. It's going to vary from child to child. No two children are going to be exactly the same. So I prefer to use this term, developmental delay syndrome. This is the unique presentation that the child presents in terms of ADD, ADHD, OCD, tic disorder, dyslexia, dyspraxia, their own unique presentation, which tells you what's happening to that child's brain in this postnatal period. Has it glitched? What's it affecting? What can we do about it? So let's give an example. When is dyslexia not dyslexia? This is a particular hobby horse of mine. A high percentage of children that struggle to read and would therefore be diagnosed as having dyslexia actually have a thing called convergence insufficiency. Now what this means is convergence is the ability to bring the eyes in towards the nose. Now you have to do that very accurately so that both eyes are looking at the same target. And for various reasons, which I won't go into at the moment, it's usually the left eye that struggles to come into convergence accurately. Now, if you cannot converge, if you can't bring the eyes in towards the nose and hold them there, you are then going to struggle to have smooth tracking, because for smooth tracking, you have to move the eyes like windscreen wipers left to right, backwards and forwards, so that you can get the words off the page. So you need convergence to have smooth tracking to have reading fluency. Now, I say that probably 30% of children that are currently diagnosed as being dyslexic have, in fact, convergence insufficiency. Other researchers will tell you it's even higher than that, maybe even 60%. Now, this is significant because dyslexia is a huge barrier to learning. Imagine if we could effectively treat 30%, 50%, 60% of children in a matter of weeks. What a difference that would make in the classroom. Imagine how that would liberate the special needs teachers. And convergence insufficiency can be detected and measured in minutes. There are computer-generated programs that will measure convergence insufficiency in fractions of a diopter. So it can be measured effectively. It can be treated by a home-based computer-generated treatment program. Child does it at home on their computer over a period of weeks, and generally speaking, the child, I usually joke and say, if the child doesn't respond, I'll shoot them. But I haven't shot one so far. Having sorted out convergence, the next thing to do is to look at tracking. And we can do this very easily by putting goggles on a child with little cameras in, get the child to read a very simple passage, and then see what the eyes are doing. Are they tracking smoothly left to right across the page? Children that struggle to read, that have convergence issues, make too many movements right to left. And when that happens, B's and D's get confused. The words like was and saw become the same. Children really struggle to process the information. Once we can sort that out, and tracking, if there is an issue, again, there are computer programs we can use that will make the eyes move across the page left to right. And we've got other programs that actually make the child look at the individual word, not just the beginning of the word or the end of the other word before it, but to look at the actual word. That can be achieved in a matter of weeks. So let's look at another very common problem, attention deficit. Attention deficit, is it? Now, attention deficit can be visual or it could be mental. So let's, for a moment, just look at visual. Some children seem totally unable to ignore any movement in their peripheral visual fields. Why? Well, could it be a little-known area of the visual system, which is called the magnocellular area? Now, if you stick your finger just above your ear, where you're touching is roughly where the magnocellular area is. You have one on each side of the brain in what's called the parietal cortex. And basically, the right magnocellular area monitors what's happening on the left magnocellular area monitors what's happening on the right. But a recent discovery shows that it's the right magnocellular area that actually has executive control. It decides, do you need to look or not? Now, when we're probably below 5, it'd be safe to say, we have a primitive defensive visual reflex. If you go back to times when we were living in caves, Mum would probably put her baby down while she's dusting her cave, or whatever cave ladies did, and maybe a wolf or something would appear at the entrance to the cave. The child has got to see this, pick it up in its visual fields, look at it, scream, so that an adult can defend the child, protect it. It's got to alert you to approaching danger. Now, at round about 5, it should be replaced with the adult selective response. I don't need to look at a bird flying past the window. I don't need to look at somebody moving in the room. I need to concentrate on what I'm doing. So, if someone's fidgeting in the room, I should be able to ignore them. If something's slithering on the ground, I've got to look because it's a potential danger. Now imagine if you put a child into a classroom that has this problem. They are going to be constantly looking around, unable to concentrate on what they're meant to be doing. So this visual inattention, this distractibility, is a problem in quite a few children, quite a number of children, and you can test this very easily. They have this problem, so therefore every time something moves, they look. So in the classroom, it's a nightmare. Can it be treated? Yeah, very simply. You can use basically a Where's Wally book, which you stand up to the right-hand side of a computer screen. The child sits there for 6 minutes a day looking for Wally, Wender, Wolf, etc. The computer generates a program that will stimulate the magnocellular area. The colors, the frequency, the form that is on the screen is known by neuroscientists to have a positive effect on the magnocellular area. So the flashing on the screen enters the left eye, crosses over to the right side of the brain, and causes the magnocellular area to work in the adult way. Very simply done, matter of weeks, can be improved. So in summary, what I've been saying here is that the learning and behavioral disorders, as we know them, do not exist. They are symptoms, they're not conditions. And it's really, really important to think about this. If you can identify these symptoms, and if you can relate those symptoms to specific areas of the brain, then, as I've suggested with convergence insufficiency and visual inattention, then there are things that we can do to correct these issues. So therefore, I prefer to talk about a developmental delay, a glitch in the postnatal development of the brain, rather than talking specifically about dyslexia, dyspraxia, attention deficit. Can it be treated? Well, the answer is, I believe, yes. Is diet important? Yes. I think it's not just important, it's essential. As I said earlier, what we eat, the food that we buy, has changed dramatically from certainly when I was a boy. When I was a child, we didn't have fridges and freezers. You had to eat fresh food. Nowadays, you can go to the supermarket, you can get anything you want, which is often laden with things that you don't want to eat. So therefore, what we have to do is give the brain, the body, what it needs, but keep out what it doesn't need. Are supplements necessary? I believe they are. I believe that the majority of children require omega-3, vitamin C, B complex, zinc and magnesium at an age-appropriate dose. Our diets do not have sufficient of these, and many, many children are deficient. The Mental Health Foundation, talking about adults, has suggested that many of the conditions that we suffer as adults, anxiety, depression, dementia, could be because we're not having enough omega-3 to keep our brain ticking over, to do the daily maintenance, the repairs that are necessary. So I suggest that we need to look at diet, supplements, general physical exercise. Our children aren't getting enough exercise. They're not getting out and about enough. Specific exercises tailored to stimulate certain parts of the brain, and computer-generated programs that can target specific areas of the brain to help them to grow, develop, to do what they're meant to be doing. If we take this holistic approach, I believe that we can actually deal with so many of these conditions in a relatively short space of time. If you'd like to read a little bit more about what I've been talking about today, Is That My Child? Was my first book on this subject. The Brain Food Plan is all about diet, how to provide a good diet for your child. And could it be you? What happens if your child doesn't get treated during childhood, if they go into adolescence or indeed adulthood with problems? And I believe that Igennus are going to be giving away some of the books today. So I think 5 lucky people are going to receive a book. I'm going to hand you back over to Nina now and the next speaker. Thank you for listening.
Okay, thank you very much indeed, Robin. That was really, really interesting. And yep, you're absolutely correct. We will be giving away some of your books later today. We'll just be picking some of the emails at random. And I believe you can be contacted directly at Tinsley House Clinic. Is that right?
That is correct.
Excellent. Okay. Right. Okay. So many thanks again, Robin. That was really, really interesting. I myself am actually going to be touching a little bit more on the nutritional aspect of it. But for now, I'm going to hand the floor over to our second speaker of the afternoon, Professor Basant Puri. His work has focused primarily on the role of the omega-3 fatty acid EPA in several conditions such as depression, chronic fatigue syndrome and Huntington's chorea. And today he's very kindly agreed to speak to us about the structural and functional roles of fatty acids in the brain and some of the evidence for the association between fatty acids and neurodevelopmental disorders. So I am now going to hand you straight back over to Basant Puri. Welcome, Basant. How are you?
Good afternoon, Nina. Thank you very much for your kind introduction, and may I thank Robin as well for his superb talk, and for those taking part in this webinar, listening in, can I just say that Robin's books are absolutely superb. I have one of his books right in front of me right now. They really are a fantastic read. So I'm going to talk very briefly about neurodevelopmental disorders, and I'll start by discussing ADHD, attention deficit hyperactivity disorder, briefly, and how we diagnose and treat it. So the cardinal features are inattention, hyperactivity, and impulsivity. Using the DSM-4-TR diagnostic system from the American Psychiatric Association, the signs of inattention are the sort of things you're, I'm sure, very familiar with. The person is easily distracted by irrelevant sights and sounds, may fail to pay attention to details, and may make careless mistakes, often lose or forget things like toys, etc. And then signs of hyperactivity and impulsivity also, according to DSM-4 TR, things like feeling restless, fidgeting, running and climbing, or leaving a seat in situations where you wouldn't really expect this to occur, or if the person's in class or at college, the person may blurt out answers before hearing the whole question. They also find it difficult to wait in line in turn. Now, the features of ADHD actually manifest differently across the lifespan, from the preschool period right the way through to adulthood. So we'll look at that in some detail now, starting with the preschool child, who will manifest inattentiveness by having short play sequences, not being able to complete activities, and not listening. They may have no real sense of danger. It's quite worrying actually for parents who might be concerned about their child, really. And then in primary school, you see a lot of these things again, really. The child be forgetful, disorganized, easily distracted by the environment, and restless when you'd expect them to be calm. You may think that perhaps an ADHD child has been scribbling over my slides earlier, but actually I was doing that when I was practicing. I didn't delete them. Impulsivity in primary school children may manifest in any of these ways that I've put here, including, unfortunately, accidents as well, which you can imagine happening and being of great concern to parents. In adolescence, again, there's a reduced level of persistence compared with their non-ADHD peers, a lack of focus on details of a task, poor planning, fidgeting, reckless risk-taking, poor self-control. And then people often forget that ADHD can and does manifest in adulthood. It's an important differential when you're trying to work out what a patient with these sort of symptoms has wrong with him or her, and sometimes it can be confused with conditions like bipolar disorder. But essentially, patients find it difficult to cope with details, have a lack of foresight, subjective sense of restlessness, and again likely to be impulsive, which may manifest as accidents, including car accidents, and of course impatience. The features of ADHD have a high prevalence and pose a serious health problem. They tend to be treated with stimulant medication, and during the 1990s, the level of such treatment went up exponentially and has carried on going up exponentially, as shown by the curve I've drawn on top of that. And this also has gone hand in hand with an increase in the consumption of stimulant drugs like methylphenidate, which have gone higher and higher, particularly in America. We just follow them. We're just a few years behind them. There are many stimulants in current use, and they should only be prescribed to children with severe and persistent symptoms of ADHD when the diagnosis has been confirmed by a specialist, and this treatment may then be continued by a GP. Dyspraxia, you've heard about from Robin just now. In addition to Robin's books, I would strongly recommend the books by Dr Madeline Portwood, who's based in the north of England and is a world authority on dyspraxia. You may also see it. Right. Is that better? Hello? Testing, testing. Someone said yes. Anne has said yes, and Amanda said yes, and oh, good, good, good. So I'll carry on then. Dyspraxia is also known as DCD, Developmental Coordination Disorder, in various papers, in case you see that term. And from the next few slides are taken from the work of Madeline Portwood. She points out that the main early indications of dyspraxia are as follows: irritability, difficulty in comforting the child from birth, various feeding difficulties, sleeping difficulties, delayed early motor development, high levels of motor activity, and repetitive behaviours such as head banging or rolling. The child may be sensitive to high levels of noise, may have problems with toilet training, which can indeed be delayed, and tends to avoid constructional toys, such as jigsaw puzzles and Lego. There's often delayed language development and emotional outbursts, and poor concentration. You can see the overlap with ADHD that Robin was talking about in his talk a few minutes ago. When the child's age between 3 and 5, in the preschool era, you'll see other signs of dyspraxia as well. For example, the child may have difficulty pedaling a tricycle. In fact, they can even fall off a tricycle. That's right, not a bicycle, but a tricycle with 3 wheels. They continue, I'm afraid, to be messy eaters, and they continue to avoid constructional toys. Their motor skills may be rather poor. And in fact, you can see that gradually they find it becomes obvious that their handwriting is not as good as it is in their peers. They will tend to become isolated in peer groups, and this might also actually be partly a function of the fact that, of course, they have difficulty toilet training and may be prone to wet themselves, and of course have language problems that continue, and that again makes it difficult for them to engage in imaginative play, particularly with their peers. Their concentration is limited. Now, Robin mentioned the role of omega-3, so I'm going to go through that in a bit of detail now, and just remind you of where fatty acids belong in the phospholipid molecules. Well, this is a Fischer projection of a phospholipid molecule, and the long-chain polyunsaturated fatty acids, or LC puffers or LC poofers, should be here at the SN2 position of the glycerol backbone of your phospholipid. These are the polar head groups that most commonly occur in the phospholipids. And so here are 2 typical long-chain puffers, the omega-6 or N-6 arachidonic acid, and the omega-3 or N-3 EPA, icosapentaeneric acid. In theory, we should be able to biosynthesize these from their essential fatty acid precursors. So the essential omega-6 precursor is linoleic acid, and through these 3 enzyme steps, it should be able to we should be able to produce arachidonic acid from it. And similarly, from the precursor short-chain fatty acid ALA, alpha-linolenic acid, we should, using the same 3 enzymes, be able to produce EPA, icosapentaeneric acid. Unfortunately, this enzyme here, delta-6 desaturase, is particularly prone to being inhibited by a whole range of factors. And as Dr. Pauc correctly pointed out, there does appear to be a functional, actual deficiency of omega-3s in long-chain omega-3s in children, and I'd say also in many adults as well, and that's because of a whole range of factors, and some of these factors I mentioned here in fact impact on that enzyme delta 6 desaturase. So back in the year 2000, Dr. Alex Richardson from the University of Oxford and I put forward a fatty acid hypothesis of ADHD, which you can read about in here if you happen to suffer from insomnia. And basically, we suggested that a whole range of symptoms and signs associated with ADHD were also ones that you'd expect to see if there were a deficiency in long-chain polyunsaturated fatty acids. I'll just go through these next few slides very quickly, but to point out that these features of ADHD which are consistent with a deficiency in LC puffers included the increased occurrence of minor physical abnormalities, sleep problems, the high male to female sex ratio, the high rate of allergies and atopy, and the existence of other somatic problems, including headaches, stomach aches, proneness to infections. It is interesting that a quarter of ADHD boys and over a third of ADHD girls have been found to meet the DSM criteria for somatization disorder, and things like the immune system and digestive functions are known to require fatty acids in sufficient and correct amounts. Emotional and mood disorders are also relatively common in ADHD, and they can also be related to a deficiency in fatty acids. So what about direct evidence for a deficiency in any of these fatty acids in ADHD? Well, there are several studies showing such deficiencies, and you can see them here. Very, very clear evidence, really. So that leads us on to the possibility of treating with fatty acids, and there have been several double-blind trials which have taken place. I'm just going to mention a few. I'm going to confine myself to double-blind, randomized, placebo-controlled trials. And some of these involve just the use of evening primrose oil alone. Evening primrose oil is an excellent source of GLA on the omega-6 side. Some have used just DHA alone, some have used high level of DHA but low levels of anything else, and some have used EPA, DHA and GLA with an emphasis more on the EPA. So let's just have a quick look at some of those. There was a study published in 1987 on using evening primrose oil for 4 weeks, or placebo for 4 weeks, in 31 children with inattention and hyperactivity. And as you'd expect, the GLA was converted to DGLA, which showed up in the blood of the children. And there was significant improvement in 2 of the tasks in the EPO group compared with the placebo group. But the authors concluded that 4 weeks was likely to be too short a period of time for such a study, and I would concur with that. I think if they'd carried on for longer, they'd have seen even more improvements probably. Another EPO study was published 2 years later, and it was EPO versus D-amphetamine versus placebo. And again, it was just a 1 month study and a random Latin square study in which teacher ratings were used. The amphetamine group did best of all, then the evening primrose oil group, and then placebo in that order. Again, the authors concluded that 4 weeks was too short a period, really. A major DHA study was the Robert Voigt study from the Mayo Clinic in Rochester, published back in 2001. This was a large study of 63 children, and these 63 children were aged between 6 and 12 years of age, and they all had ADHD. They received DHA or placebo for a full 4 months. And as it says in the abstract, there was no statistically significant improvement in any objective or subjective measure of ADHD symptoms in the DHA group. And that is correct. There was no statistically significant improvement in any objective or subjective measure of ADHD symptoms. In fact, if you drill down into the data, you find that there's even more you can find out, really. Their measures included the TOVA, which many of you will be familiar with, the test of variables of attention, and a colour trails tester, one for children. And for those of you who are not familiar with it, the TOVA is an age and sex-matched, or sex-normed, sorry, computerized test which measures sustained attention. I won't bore you with the full details. Those of you who are not familiar with this can look at this later. And the children's colour trail test is again very familiar, something that's very familiar to most of you, I should think. You just have a whole lot of numbered circles, 1, 2, and so on, and you've got to join them in order, and then you've got to join them alternating between pink and yellow circles. So it's quite a clever test, really. And it wasn't just the case that the DHA group did no better than placebo, because if you look at the details carefully from the paper itself, and these are copy and pasted this from the paper itself, you'll see that indeed there are a significantly increased number of errors of omission on the TOVA in the DHA group compared with the placebo. So in fact the DHA group did significantly worse than the placebo in respect of errors of omission in the TOVA. And then when you look at errors of commission, it is true that the DHA group showed a small reduction in errors of commission, not a significant reduction, but a reduction. However, the placebo group showed a highly significant reduction in errors of commission. So let me just repeat that. The placebo group showed a significantly high reduction in errors of commission. So again, the DHA group performed worse than the placebo group on errors of commission. And then if we look at the colour trails results, you see that there was a significant reduction in the time taken to perform this task for the DHA group, but there was also a significant reduction for the placebo group, and in fact for the placebo group it was even more significant. The numbers may not look as if that's correct, but if you look at the standard errors of the means, you can see that this is even more highly significant. So again, it looks as if the placebo is doing better than the DHA. And at the end of their paper, they did say that indeed, despite a lack of data to support either efficacy or safety, DHA supplements are readily available and are being marketed for the treatment of children with ADHD. Thus, these data do not support the efficacy of DHA supplementation as provided in this study. I'll stop there. So, what about any more DHA studies? Well, there was one published in 2004, high DHA, small amount of EPA, no even primazole, in fact 3.6 grams of DHA a day in 40 children with ADHD. And what they found, interestingly, was that in the DHA group, compared with the placebo group, there was a change in auditory short-term memory, which was worse in the DHA group than for the placebo group. I repeat that, worse. The change in visual short-term memory was also worse than for the placebo group. And the changes in a continuous performance test were again worse for the DHA group than for the placebo group. Errors of omission improved significantly in the placebo group again, and they were worsened in the DHA group. Errors of commission improved significantly in the placebo group, and again they worsened in the DHA group. On the other hand, on a standardized test of attention, the DHA group showed an improvement. However, the placebo group showed an even greater improvement. So again, it does look as if the DHA group did worse than the placebo group. And the authors of that paper suggested using pure EPA rather than DHA or fish oil in future trials. So in general, so far, we've seen that evening primazole has some benefits, but I think you have to give it for more than a month, really. And we've seen that so far the DHA trials were negative, proving worse than for placebo. Of course, I would just point out the DOLAB trial results that have just come out, which were carried out not in ADHD children, but in healthy school children aged between 7 and 9 who were initially underperforming in reading. But sticking with children who are sufferers, back in 2000 we hypothesized that EPA itself was likely to be therapeutically beneficial. We had several reasons for thinking this. One is that it is a precursor of a whole range of icosanoids. Second, it is a precursor of DHA, so people are worried about a lack of DHA, you'll get it from this. And also EPA inhibits cytosolic phospholipase A2, which is an enzyme or group of enzymes which, amongst other things, breaks the bond between long-chain polyunsaturated fatty acids and the SN2 position of membrane phospholipids in the glycerol backbone. So we published a study back in 2002 in which we compared 28 ADHD children with 45 normal controls, and they received a combination of omega-3 and omega-6 fatty acids, the omega-6 from evening primazole, virgin evening primazole, and there were positive results after 3 months. Most of these children had dyslexia, or essentially they had dyslexia, and this is what they received: EPA, some DHA, some GLA, GLAs from evening primazole, vitamin E, some AA as well. We gave the placebo group olive oil, which in retrospect I think was a mistake because olive oil itself is active. But here are the results, and you can see that essentially these are effect size results. You can see that in the first 3 months of the study there were a lot of improvements with the, here we call them highly unsaturated fatty acids, HUFA or HUFA, and here are some more positive results. Now, at the end of the 3 months, the study was the children underwent a one-way crossover. So all the children who had received placebo now started to receive the fatty acid supplement, and the ones who had been receiving the fatty acids carried on receiving the same fatty acids. And you can see that now there's it's time for catch-up, as it were. A lot of the crossover children doing significantly well, really, and on a whole range of scores. This crossover part of the study has not yet been published. And so just to show you what happens on the fatty acids, the children do really well, and when they carry on fatty acids, they continue to do well. The lower the score, the better. It means the lower the level of anxiety and shyness on that particular rating. The placebo group, if anything, did slightly worse. Became even slightly worse during the first 3 months, but then they started to catch up when they were on the active, and that, of course, this one parallels this one, if you can see that. This study design was repeated with a formulation that contained even more EPA by Alex Richardson and Paul Montgomery in 2000, or published in 2005. It's the Oxford-Durham or Durham-Oxford study, depending on who you talk to. But it was a huge study, really, 60 versus 57, and the results were published in the journal Pediatrics. You can see this time they received a very high dose of EPA, but again they also received virgin even-primazole in the active group. The placebo group, again, I'm afraid, used olive oil. If we hadn't used olive oil, I think the results would have been even more significant, possibly. And these are just results taken from the paper itself. Essentially, you can see significant improvements over 3 months in the active group in respect to reading, spelling, and behaviour. And after crossover, similar changes were seen in the placebo group. And the conclusions from the Oxford-Durham trial were that fatty acid supplementation may offer a safe and efficacious treatment option for patients with DCD, they had dyspraxia. So in the last few minutes, just going to say a little bit more about studies where EPA has been used. Before I deal with the most recent study, there was a systematic review and meta-analysis published back in 2011 in the Journal of the American Academy of Child and Adolescent Psychiatry, comparing results thus far. And you can see from their results they found that the higher the dose of EPA, the higher the effect size from the trials that have been published that until then. And so the authors concluded that from looking at 10 trials involving 699 children, that icosapentaenoic acid, i.e. EPA, the dose of EPA within supplements was significantly correlated with supplement efficacy. So the final trial I want to mention very briefly is one that's just come out this year, 2012, and this is from Professor Pereira and colleagues from, I was going to say Ceylon, Sri Lanka, it used to be called Ceylon, and they used design in which the children received 6 months of placebo or active. It was a large study which involved 49 children in each group, and in the end 48 in one group and 46 in the other completed, and they used a very high dose of ethyl EPA. All the omega-3 was ethyl EPA, and then the omega-6 was essentially from virgin even-primazole, GLA. And after 30 days, they saw improvements, and after 6 months, highly significant improvements. So you can see here that this is the last slide, by the way. Outcome was measured at 3 and 6 months after treatment using a self-assessment checklist completed by the parents. Statistically significant improvement was found in the treatment group compared with the placebo group in the following measures: restlessness, aggressiveness, completing work, academic performance, and distractibility did not show improvement, and then it had rather high effect sizes. I think I'll stop there, actually. Thank you.
Right, okay. Many thanks, Professor Puri. Again, another very interesting topic and a very interesting talk. So I am now going to hand myself over No, not quite that far yet. Right, okay. I beg your pardon. I just need to. Right, okay. So, yes, very many thanks, Professor Puri. I'm now going to elaborate slightly on some of the topics that we've already spoken about and heard about today. And I'm going to be focusing on nutrition and the role that nutrition plays in managing developmental disorders. And as we sort of walk into our major supermarkets, you might not see quite the same view, but basically we go in and a lot of the food that we're sort of choosing is very much sort of packeted and in boxes and that kind of thing. And the reason that I want to talk about food today is because, well, A, it's incredibly important. Food is composed of the elements that our body needs for building our tissues and for each and every metabolic process that goes on within our cells. And the food that we choose to eat and our overall diet can improve our health, and it can reduce or increase the risk for certain diseases and conditions. Now, the whole kind of concept that we are what we eat certainly isn't very new. And if we look back, if you really want a good sort of nutrition quote, you can look back and sort of look at Hippocrates. He's sort of had many of them. And this is one of my favorites. It's leave the drugs in the chemist's pot if you can heal the patients with food. And I think that there's an awful lot to be said for this. But if we sort of look back a little bit further, if we go back to looking at our sort of ancestors, I think this has been touched on a couple of times as well. And if we go back to our sort of Paleolithic time, going back very early Paleolithic, 2.5 million years ago, when we were hunter-gatherers, so we basically ate what we could find and we sort of ate what we could catch, really. And then we sort of moved over into the Mesolithic period and then finally into the Neolithic period, where we saw the introduction of farming methods and the introduction of agriculture. And this has had a profound effect on our diet, and it's further changes in the last century, really, and even more so in the last couple of decades, that have really accelerated this process. We've seen some huge advances in food refining and huge progress in food processing. And we really kind of focus around sort of food's convenience rather than sort of foods for nutrition. And one of the issues that keeps raising its head is, have our diets actually evolved faster in the last century than our genetic makeup can cope with? And I think one of the best examples of sort of explaining this to people is looking at the omega-6 to omega-3 ratio. And I'm aware that this has been touched on again in previous slides and talks today. But pre-agriculture, our ancestors, they survived on a very balanced intake of omega-6 to omega-3, and therefore they lived on a very balanced production of the metabolites that arise from the omega-6 and the omega-3 families. Modern times, our ratio has changed very much in the favour of the omega-6 family, and with this there comes possible health consequences. Now, one of the questions that has come up earlier is the sort of differences between omega-6 and omega-3, and sort of highlighting omega-6 and omega-3 as a nutritional approach or a nutritional tool for treating neurodevelopmental disorders. And basically, not all omega-6 are the same and not all omega-3 are the same. Some omega-6 are considered to be very inflammatory and other omega-6 are considered to be very anti-inflammatory. And it generally is influenced by the amount of omega-3 that you have in your diet. So if you have a low omega-3 intake, you're shuttling the omega-6 pathway down an inflammatory route. Now, the main inflammatory omega-6 is called arachidonic acid, and the main anti-inflammatory omega-3 is called EPA. And we can learn a lot from either looking at the omega-6 to the omega-3 ratio, or as a more or as a better outline of what's going on in the body, the arachidonic acid EPA ratio. And this is where sort of talking about how this ratio has changed dramatically in the last century. And we are now seeing that a raised arachidonic acid to EPA ratio is very highlighted in many, many different types of conditions and diseases and disorders. Anything from sort of mental health, depression, bipolar, to pain diseases or pain conditions such as chronic pain, fibromyalgia, ME, CFS, even through to sort of diabetes, cardiovascular disease. And if we look over here on the right, we see that it's also related to neurodevelopmental disorders. And I think we've had a little bit of a sort of clarification as to why. But if we actually look at polyunsaturated fatty acids, so again, omega-3, omega-6, these are cells that become incorporated into our cell membranes. And within those cell membranes, they play many, many roles. They are important for the fluidity of our cells, so they help to either they help cells to communicate to each other, for example. But it's the arachidonic acid and EPA ratio that's important, because these two long-chain fatty acids, they give rise to products called eicosanoids, and these eicosanoids are involved in regulating our inflammatory processes. They look after our immunity, they look after our cardiovascular systems, and these long-chain fatty acids also play a major role in brain structure and function. And if we just go back just slightly here, we have an omega-6 here called DGLA. And this is our anti-inflammatory. And the precursor to DGLA is GLA, which we find in our organic evening primrose oil. Unfortunately, we can't really sort of find supplements that have a level of DGLA in there. So we use evening primrose oil as a source. And DGLA is anti-inflammatory unless you don't have very much EPA, and then it will become inflammatory. So maybe that, I hope, is a bit of a clarification. So when we're talking about neurodevelopmental disorders, there are several hypotheses that have arisen trying to explain the role of long-chain fats. One of them is that there is an insufficient conversion from the short chain to long chain. Another one is that there is just simply insufficient dietary intake of these long-chain fatty acids. So if we're talking primarily about EPA, we're looking at sort of seafood and marine products, fish oils. And also that these children have a very rapid metabolism of these long-chain fats. So they may be making them quite adequately, they may be consuming them quite adequately, but their usage is higher than the body can actually cope with. They're not being replaced at a rate. And this is where supplements such as ethyl EPA comes in, because they offer very convenient ways to provide the body with the long-chain fats that are needed that may not be possible through diet alone. And we've heard from Professor Puri that the dose of EPA is very, very important. And whilst we find EPA in marine products, so we can sort of eat fish, we may not be able to get the amount of EPA through fish consumption alone. And we also are aware that there are issues with fish with the sort of purity levels. A lot of fish species are highly contaminated with methyl mercuries, dioxins, and such the like. So again, these ethyl EPA supplements are highly concentrated. They're incredibly pure, which makes them safe. And the addition of GLA, which is your anti-inflammatory omega-6, allows a long-term use of EPA at high doses. Some individuals find that preloading with pure EPA is a sort of step one of restoring EPA levels before moving on to the introduction of GLA as a long-term sort of maintenance dose. Now, Just going back slightly to the study that Basant Puri was talking about, in which these children with ADHD were supplemented with EPA and GLA combination. If we just look at the next slide very quickly, because people are very sort of interested in what kind of areas that these supplements are going to be able to help with. And in a minute, I'm going to give a little bit of an explanation as to how EPA and GLA actually bring about these benefits. So several points were looked at. So we have aggressiveness, restlessness, inattention, distractibility, easy anger, and so on. And one area that this study highlighted that was quite interesting was that after 3 months of treatment, we start to see benefits in areas such as aggressiveness and restlessness. So anything that's highlighted green, we're seeing benefits for within the 3-month period. Where the highlight is red, we're not seeing statistically significant benefits. After 6 months of treatment, however, the areas of green are showing again that this continued treatment still has benefits, and after 6 months, areas such as inattention become statistically significant. There was only one area, and that was distractibility. And if we look at it on a sort of graph, we can see that whilst there was a small placebo effect, so the top line is our placebo effect at 3 months, and our top line is our product at 3 months. The placebo effect actually starts to drop, so the amount of children showing improvements actually begins to drop. You'll always see, pretty much always, you'll see a placebo effect. But in this case, that placebo effect dropped whilst the supplement continued to show benefits. So that there is a treatment time and there's a dosage that really needs to be looked at. So how does supplementing actually help? It's all very well sort of taking the supplements and hoping, but having a bit of an understanding of how EPA and GLA actually function within the body is very important. And one thing that we know is that these fatty acids are known to help regulate neurotransmitter function. So if we look at our two main neurotransmitters, dopamine here, and we have serotonin at the bottom. Now, dopamine plays a huge role in sleep, mood, attention, memory and learning, in behavior and cognition, voluntary movement, motivation, punishment and reward, whereas serotonin, again, mood, emotion, sleep and appetite. So if your body is not managing to either produce neurotransmitters, or if your body is not able to use them properly, then we're going to start sort of seeing issues in these areas. EPA is also known to modulate the activity of sodium and potassium and calcium ion channels that are required for the control of the electrical impulses that are required to shoot from nerve cell to nerve cell. EPA and GLA also downregulate the production of inflammatory products that are derived from other fatty acids. And they also directly increase the production of anti-inflammatory products through their own synthesis, or they can regulate genes involved in inflammation by switching them on or off as necessary. And we also know that inflammation plays a role in many conditions where there is a high omega-6 to omega-3 ratio. So the fact that I'm sort of talking about serotonin and dopamine brings me around to the sort of subject of the importance of protein. And when we consume our piece of beef, our egg, our fish, or whatever our source of protein is, our bodies digest our protein through protease enzymes. And the individual amino acids, so each circle represents a different amino acid, some duplicated, and these amino acids enter what's called an amino acid pool. different types of proteins, so animal proteins, for example, are known to contain what are called complete proteins. Vegetarian or vegetable-sourced proteins don't have the same kind of protein quality. But once our amino acids have entered our amino acid pool, they then provide building blocks to make our neurotransmitters. So here we go, we've got serotonin and dopamine. Once we're in the body, serotonin is produced from tryptophan, which is our base amino acid, which is converted to 5-hydroxytryptophan, which converts to serotonin. And then on the right-hand side here, we've got phenylalanine, tyrosine converting through to dopamine. Now, the reason that these particular amino acids, tryptophan, phenylalanine, and tyrosine, are highlighted is because they are known as essential amino acids, much like the essential fatty acids. These are amino acids that must be consumed in our diet. So if you're not getting a really good source of quality protein, then it's likely that your body's just going to have a potential block to being able to build these neurotransmitters. And so if we look at the kind of protein that that we could possibly eat, and I'm talking about animal products really, because like I said, that they are comprised of the best source of protein. If you're choosing the sort of chicken nuggets and the beef burgers and the sausages over your chicken, or basically the precursors to these products, basically if mum shops at Iceland, then you may have issues. And the reason for this is that many of these sort of lesser products, if you like, are made of low quality meat, bits and pieces. They tend to be quite high in gristle and bits and pieces, and generally they don't contain as many of the essential amino acids that are required for neurotransmitter synthesis. And so, going back again, and this has been highlighted a couple of times already, is that the introduction of sort of farming methods and food refining methods has seen the modification of very basic foods with the sort of concept that this is going to improve shelf life, it's going to improve storage, it's going to enhance flavor, the color, and so make it a lot more palatable for people. And now we're finding that refined foods are making up the bulk of what we call our Western diet. But food refining results in the loss of essential minerals, vitamins, enzymes. They're lacking in fiber, in antioxidants, probiotics, the proteins, essential fats, and phytonutrients. And we're consuming an awful lot of food that are comprised of sort of empty calories with very little or no nutritional value. And there are several detrimental effects on physiological and metabolic processes. And so if we go back to a previous slide, and now what I've done is I've added in a few of the cofactors that are actually required, because it's all very well. So say we've got our protein, we've got a good protein source in our diets, so we have our tryptophan, converts to 5-hydroxytryptophan. If you haven't got your vitamin D in your diet, and vitamin B12, and folate, and over on this side, iron, zinc, folic acid. So if your diet is lacking in the essential vitamins and minerals that are needed as cofactors in these conversions, then again, we're going to have another block. So you can see that there's lots of variables coming in and influencing. And going back to a slide here as well, the conversion of our omega-6 through to arachidonic acid, our omega-3 through to EPA. Various cofactors are required for each of these steps. Any enzyme process or enzyme-driven process is going to require cofactors. And delta-6 desaturase, delta-5 desaturase all need a variety or various mixtures of these essential cofactors. And again, I use the word essential B complex, for example, if you're not consuming it in your diet, then your body will not store it, unlike vitamins such as vitamin E, for example, which your body can store. And again, there are various inhibitors of this delta-6, which is our very first enzyme in the metabolism of the essential fats. So poor micronutrient status, diets that are very high in saturated fat, in trans fats. Some individuals have genetic makeup that slows this process down. I'm hoping that your child isn't drinking alcohol or even on statins, but there are several factors that actually inhibit delta-6 as well. So again, we're seeing lots of sort of variables that are coming in and influencing our sort of normal metabolic processes. And I think Robin Pauc touched on earlier as well that many of the common deficiencies that we are observing in neurodevelopmental certainly include omega-3, but there's a huge role for magnesium and a huge role of zinc. And there are several studies that have shown that magnesium and zinc, either in combination or on their own, can have huge benefits for children. And so we can sort of really summarize this part by sort of looking at diet quality in terms of its sort of energy density. Low energy dense foods such as fish, lean meat, fresh vegetables and fruits have a higher content of vitamins and minerals, omega-3s, and are generally characteristic of better quality diets. Whereas the energy dense and nutrient poor foods such as those that are high in refined grains, added sugars, added saturated fats and omega-6 fats tend to feature feature highly in poor quality diets. And just so that you all know, this is an example of the bottom one, not the top one, just in case there's, except for the lettuce. And I think certainly that if our products were actually labelled honestly, it would definitely influence our choice of food. And here we have a rather upset mother and the rather loud child wanting his ADHD flakes. And so the whole sort of the kind of concept of food for convenience and the sort of detrimental effects that sort of what the kind of things that we're actually putting into our food to make it look nice and taste nice. And this gentleman here, Dr. Benjamin Feingold, some of you may be aware of who he is, but he first suggested in the 1970s that some of the food colorings and flavorings that we were putting into our food may be having a detrimental effect on children and may even be related directly to ADHD. And his diet focused primarily on cutting out all processed and refined foods. That in itself would directly exclude artificial colorings, flavorings, and preservatives. But he was also very focused on eliminating these products here, salicylates, which are naturally occurring aspirin-like substances. Now, one of the downsides of this is that there's a wide variety of foods that contain these products, and they generally are found in fruit and vegetables. And so restricting numerous fruits and vegetables is a little bit risky, obviously, because of the vitamins and minerals that we need. So anybody who finds that their child may be sensitive to these products would possibly need to sort of do food restrictions with the help of a sort of qualified dietitian or nutritionist. I would list a variety of foods for you, but it's probably easier to have a look at the site here at the bottom because there's just far too many. But they do differ in the actual amounts. Some foods are much higher and some foods are very low. And another aspect is the presence of leaky gut syndrome in many children with developmental disorders. Now, leaky gut syndrome is generally, if you want to put it very simply, it's where large spaces develop between the cells of a gut wall, and what happens is that bacteria, toxins, and certain foods can leak into our bloodstream. And whilst antibiotics are certainly considered to be blamed, we start looking at things like wheat and dairy as well. And a lot of children with developmental disorders tend to have sort of allergies or such to gluten and casein found in wheat and dairy, for example. And the issue with these is the gluten and casein, they give rise to opioid peptides, and these are small peptides that they get through the cells of the gut wall, and they make their way through the bloodstream to the blood-brain barrier, across that, and then start playing around with the peptides area in the brain, known to play a role in motivation, emotional attachment. So a lot of children with developmental disorders do very, very well when gluten and casein is eliminated from their diet, and also possibly supplemented with a good probiotic to help restore a normal gut flora. So for any parent who's aware that their child, I guess, could benefit from an elimination diet, I mean, the whole concept can be a little bit daunting to start with. Many children with developmental disorders are generally, or can generally be, quite fussy eaters. And so sort of getting them on your side and getting them to be proactive with you can be quite tricky. So it's doing it slowly. And keeping a food diary can also help by identifying any sort of potential food allergies or triggers is the sort of first port of call, really. But my suggestions is the most obvious. If you eliminate all processed and refined foods and you start going back to cooking from scratch with fresh organic products where possible, you can make some really good positive steps. This would certainly eliminate artificial colourings, flavourings and preservatives, for example. Not all children necessarily respond badly to gluten and dairy, but if you can eliminate this may be helpful as well. Not only is it easier to determine what your child is eating if you cook from scratch with your own raw ingredients, but the overall health benefits can actually be superior. And so if we actually look at everything that I've sort of spoken about sort of fatty acids, about proteins, about eliminating the sort of refined, heavily processed foods, we're actually almost all the way back looping to my first slide when we're talking about paleo diets and sort of going back to sort of lean proteins from grass-fed meats as a complete source or a source of complete protein, seafood as another source of complete protein, fruit and vegetables. There are, when I say complete proteins, it is possible to get complete proteins through different dietary sources of vegetarian products, but you have to do a little bit more mix and matching. It's just convenience, really, to talk about meat products because they do provide complete proteins, but it is possible to do it if you're a veggie. Fruits and vegetables providing your antioxidants, your vitamins, minerals and phytonutrients, and nuts and seeds as a source of very healthy fats, and again, vitamins and minerals. And in fact, the whole sort of paleo diet concept is coming more and more into the sort of media as more individuals are finding that adopting this kind of very basic diet is having tremendous health benefits in a wide range of areas. So to sort of round up what I'm going to be speaking about now, is there a role for supplements? The answer is yes. I think if you can get what you can through diet, then that's your first port of call. But there are roles for supplements. Probiotics certainly to help restore a healthy gut flora. EPA and GLA as your omega-3 and omega-6, not only for anti-inflammatory for gut health, but also to help with your neurotransmission, and a good source of vitamins and minerals to provide the cofactors that are required for the metabolic pathways. And so in my final slide, if you do have any direct questions that aren't answered here today, you can contact us at info@igennus.com. And if you want any info on the books or products that we actually stock, you can find these at shop@igennus.com. And we will be giving away, as I said earlier, some of Robin's books and some of Professor Basant's books as well. If you want any more information on our future webinars, you can contact us directly at info@igennus as well. So I am now going to find my other speakers, and we're going to have a look at the questions. And so I believe that some questions have already been put to the floor. So if I just dig out my speakers and give them a voice, and they'll be able to answer some of the questions. I think if I can direct Robin. Are you there, Robin? I've got a question already. Whilst I then... Can you hear me, Robin?
I've been listening.
Right, okay. I had a question earlier from, I think it's Marina, who asked, can an alcohol-induced conception have an effect on the overall behaviour of a child later in terms of development? Is that something that you'd be able to maybe answer for us? Have you got any ideas on that?
Yes. I saw that question pop up, and I have to say I laughed, because I think probably half the children on the planet
yes,
probably were conceived after a glass or two of red wine. If it's just that, then a couple of glasses of wine, a night of passion, no problem. It's only if there is persistent high levels of alcohol consumption that you really do need to worry. So alcohol consumption at high levels or drugs can cause problems to the child and are a significant factor in developmental delay. The odd glass of wine, a lovely evening out, candlelit supper, no problem.
Excellent. Okay. I think I would probably generally agree with you on that as well. I think if it's a sort of a one-off, then that's not going to make a huge amount of difference. In regards to sort of alcohol during pregnancy, that we seem to be getting a lot of mixed messages, and I think there was a paper published recently that was actually suggesting that even one glass of wine during pregnancy might not be that good for the developing fetus. But like I said, we do seem to get a lot of mixed messages on that. But if in doubt, certainly during pregnancy to avoid it altogether. But during conception, I think it's a bit of a one-off. It's probably not going to be that bad. But I mean, generally, if women are going into pregnancy, if they're aware that they may be going into pregnancy, then they probably should consider to look at going into pregnancy well nourished. So dosing up on some. Okay, I'm getting a little bit of feedback. I'm just looking at what's causing the feedback. Right, no. Right, okay. I'm just gonna check my sound levels with Professor Puri. Professor Puri, are you still there? Can we hear you?
Yep, I'm here. Can you hear me?
Right, lovely. Okay, so, right, okay. I'm now going to ask. I think there was another question for you, actually, Robin. Penny Webster was wondering what computer programs are available for visual convergence, and can it be done at home?
Right. Yep. The actual tests are normally done sort of in proof. So there are some optometrists, some opticians who will actually be able to test binocular vision. And what happens is you use a 3D image that moves a tiny amount on the screen. You wear 3D glasses, and your ability to see the 3D images, the computer then calculates a measurement of convergence, divergence. And then you can use programs at home that will actually gradually. This is a brain-based problem. There's a great debate that's going on at the moment as should it be optometrists or should it be neurologists that are treating this sort of condition. Convergence insufficiency, convergence issues is a brain-based problem, and basically there are computer programs you use at home on a day-to-day basis. Not very many people actually have them, so that it's not commonly available. But you use them on a daily basis and they will correct the convergence issues probably in something like 3 to 4 months, depending on how compliant the child is with the treatment. Hope that answers the question.
Yeah, I think that probably answers. So just a quick question. What about sort of general computer games? What's your opinion of those? Because it's sort of we're seeing more and more children sort of stuck indoors. They're not watching television. They're on their Xbox or on their Wii. Is there any sort of benefits for sort of hand and eye coordination? Should we be encouraging or discouraging our children from these kind of things?
Limiting severely. Basically, if you're playing a computer game for 20-30 minutes, it is actually beneficial. But unfortunately, and the manufacturers of these programs will tell you, they build in success and failure to these programs to make you want to do it more and more. And a lot of children and adults, there's a particular part of the brain that's called the anterior cingulate, and the front part of that, the ventral part of it, basically there's an area there which can become very adversely affected if you stay on the game too long. It's like an addiction, if you like. And what happens is, and a lot of parents would have seen this, your child's on the computer playing a game 30 minutes, 40 minutes, an hour, 2 hours. When you try to get him off, all hell breaks loose. So the idea, I would suggest,
Yes.
is limit computer programs to 30 minutes maximum in a day.
Excellent. Okay, many thanks for that, Robin. Okay, I think there was a question for Professor Puri. In some of your slides, this is a question from Amanda Edwards. In some of your slides, when you were relating to some of the studies, I think the children actually had ADHD. Amanda wants to know, does the same apply? So would the same benefits apply to children with ADD?
So, Amanda, thank you for your question. ADD is the name that was given to the disorder back in 1980 by the American Psychiatric Association's DSM-3. That is the third edition of the Diagnostic and Statistical Manual of Mental Disorders. We're now on DSM-4 TR. We're just about to have DSM-5 published. So, as you can tell from the name ADD, the idea was that inattention and impulsivity were the two cardinal features, and hyperactivity didn't have to occur. That was the theory. But by the time DSM-3 was revised in 1987, DSM-3R, if I remember correctly, ADD had changed to ADHD. In fact, if memory serves me, it was ADHD with hyperactivity or ADHD without hyperactivity. But as you'll have seen from some of the slides relating to the results of the double-blind trials with various combinations of fatty acids, when the fatty acids do work, they cause improvements not just in hyperactivity but also in inattention and impulsivity, and therefore the strict answer to your question is yes, the same does apply to ADD as to ADHD.
Actually, that might lead quite nicely into Rachel Reynolds' question. Is there any evidence that EPA can help with Tourette's syndrome, Professor Puri?
I don't know of any large randomized placebo-controlled trials of ethyl EPA in Tourette's syndrome. I do know that a colleague and I considered carrying one out some years ago based on clinical evidence. I can picture one particular patient who had been treatment resistant with marked Tourette's, Gilles de la Tourette syndrome, and I gave him ethyl EPA. I don't recall now whether there was even primazole there as well. I think not. I think it was ethyl EPA. And he showed marked improvement, and the improvement occurred from memory within 3 months. So I'm afraid I never got around to writing up that case report, and I never did apply for funding for a trial on Tourette's, but so I don't know the answer to your question in terms insofar as there hasn't been, so far as I know, a large-scale, double-blind, placebo-controlled, randomized trial of ethyl EPA in Tourette's. But clinically, my impression is that it does appear to help.
Okay, right. I have some more questions coming at the moment. Okay, let me refer the next question, I guess, to myself. There was a query about the EPO and EPA in combination. I'm hoping that my talk actually clarified that for you. But the sort of simple explanation is that not all omega-6 are bad, and I think we get a lot of negative messages out there that we should avoid omega-6 like the plague, but that's not actually true. It's more about restricting certain types of omega-6 and increasing our omega-3. So there are huge benefits to combining GLA, which is our anti-inflammatory omega-6, with EPA. I'm just going to have a look now, and Steve Williamson is asking, how effective is treatment in teenage years? Do you have any opinions about that, Basant, Puri?
I think it is very effective, really. But again, I'm going from my clinical experience. The trials, as you've noticed, have essentially taken place in school children. Often up to the age of about 12 years. But from clinical experience, children in their teens, and indeed adults as well, we mustn't forget that adults also suffer from the disorders we've mentioned. Teenagers and adults do appear to benefit as well. But I'm afraid I can't point you to any randomized placebo-controlled trials in teenagers or adults, but maybe one of the listeners might know of one that I've missed.
So, Robin, your opinion on this, what sort of age group do you treat with your sort of holistic approach and the sort of supplement combo with that? Is it generally children that you see? I mean, your book is sort of, Is That My Child? But I'm sure you see people all the way through into adulthood, yes?
That's right, yeah. Could It Be You is basically looking at adolescence and adulthood. The only problem, I would say, my clinical impression is that, yes, it works equally well for adolescents and adults. The thing you have with the older child, and it's something that I always say to parents when they contact me, is will your child be compliant? Because if you've got a 6-year-old, 7-year-old, you can implement the diet, the supplements, the exercises, etc., etc. If you've got a child of 12, 13, 14, they can just say, I'm not doing that, and there's nothing you can do about it. So without compliance, you've got real problems. And I think that's the only negative that I can think of.
Yeah, no, I'd probably agree with that. I mean, that we generally sort of tend to focus on children when we're talking about attention deficit hyperactivity disorder for certain. And we sort of forget that these children grow up to be adults. So generally, I mean, we certainly know that a lot of adults with ADHD come to Igennus and use our EPA-GLA combos quite successfully. In regards to questions, so vegetarians, we're talking about sort of the whole kind of EPA-GLA use in treating. If I just go back to a slide here, if this might help sort of clarify things a little bit. Vegetarians and vegans rely on plant-sourced omega-3 and omega-6. So plant-sourced omega-6 LA is found in sort of common sunflower oil and common oils such as that. ALA is generally found in products such as flaxseed oil. It's from these plant versions that all the other omega-3s and omega-6s are produced. Now, the issue for vegetarians and vegans is that this delta-6 desaturase, this is a rate-limiting enzyme at the best of times. So as humans, it's not the most functional of enzymes. And only about anywhere between about 4 and 8%, I believe, of ALA actually converts all the way down to EPA. And again, all these sort of cofactors are required, and we've got all these inhibitors on top of that. And so if you're a vegetarian vegan and you're relying on flaxseed oil as your source of omega-3 and you're needing high levels of EPA, then it's quite likely that as a vegetarian or a vegan that you're going to be deficient. Now, there are other options. You can take a product called Echium seed oil. Igennus produced this as a product called Echiomega. And Echium seed oil is very unique because it actually contains a very high amount of a product here called, or fatty acids, sorry, called stearidonic acid. And this stearidonic acid effectively bypasses the delta-6 desaturase step, so it converts very rapidly into EPA. So, and it's actually a very unique oil in that it also contains GLA. So it's like a sort of it's like a Vajipa precursor, if you like. So it's certainly a superior oil to sort of common flaxseed oil. But I would also kind of generally say to people that, you know, if you can take high EPA, and if you're willing to sort of take an EPA oil, then a fish oil would be your best option, or a high purified EPA product. In regards to sort of dosing, many people find that they start off on a high dose and they can sort of whittle this down to a relatively sort of low dose. And it is generally long-term as well. I mean, the health benefits from taking omega-6 and omega-3 are sort of focusing on things like your inflammatory system, your cardiovascular system, your immune system. So it's giving support to all these sort of processes within the body. So it's certainly going to be doing more health benefits than it's not. Generally, I mean, our intake of long-chain EPA or long-chain omega-3s should be around 0.5 gram a day. And this relates to about 2 portions of fish per week, one oily, one white, and we're not really even sort of managing to do that. The average sort of intake of long-chain fatty acids per day is about 1/4 gram, and if you're not consuming marine products, it's about 50 milligrams, I believe. So it's very, very low for non-fish eaters. In regards to starting off on a sort of loading dose of pure EPA, many people find that they start off on maybe 1 to 2 grams of pure EPA for a period of about 3 months before adding an additional GLA component, so before moving on to Vajipa. We have various sort of information pamphlets and things that you can contact us directly to. We're happy to provide any information, and on our website as well at igennus.com. You can find information on download packs for sort of nutritional guidance, and also mechanisms of action for the products themselves. Okay. Oh, right. Somebody's just found Eckium seed oil. Excellent. Okay. Okay. And Sophie's come in to say that she takes it as well. That's fantastic. Um, Asperger's syndrome. Right. Okay. We've just had a question from Leda Samuel. Is there any evidence to support the use of omega-3 in Asperger's syndrome? I would suggest, as Asperger's comes under the sort of realm of neurodevelopmental disorders, but I'll pass that over to Basant Puri. He's more of an expert on that than I am. So, what do you think there, Basant Puri?
Oh, well, thank you for that question. I don't know the answer, to be perfectly frank, as to whether there is any evidence. I do know that many practitioners do give omega-3 fatty acids to patients Asperger's. My own practice is somewhat similar as well, but it's difficult to know which of the many changes I or colleagues make in the diet and other lifestyle habits of my patients are responsible for the beneficial changes, because it's not just a matter of adding in, say, ethyl EPA and maybe virgin even primazole. There will be many other changes, the various vitamin and mineral nutrients which we mentioned earlier. Um, 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 by increasing the amounts of those, that may cause a change, and it's quite common that my patients with well, not just Asperger's but ASD, autism spectrum disorder, may be found to have a gut dysbiosis, and so there'll be changes made there as well. And all these changes essentially happen roughly at the same time over the course of, say, 4 to 6 weeks. So a patient may come in for the first time, and the comprehensive stool analysis results may be back about 4 weeks later, by which time the patient may be on fatty acids, but may also be on nutrients and other forms such as vitamins and minerals. And then, of course, it may be that as a result of the stool analysis, one recommends other changes such as various probiotics, and so perhaps a gluten-free diet and so on. And so you see improvements, but you don't know if it's one particular part of the changes that is responsible. I suspect not. I suspect it may be it's the combination. And I know many people, medics and nutritionists, who have a similar approach and who also see benefits. The strict answer to your question is I don't know if there's any evidence in particular for that particular part of the change that one makes in, or may recommend making in the intake of such a patient.
Oh. Okay, sorry, I've been told that we're losing sound.
I wasn't.
Ah, right. Okay, sorry about that. I think we lost a little bit of sound there, people, so do beg your pardon for that. I'm not sure. Is there anybody who hasn't had their question asked? Oh, thank you. Hello, everybody. Okay, so I'm just wondering what questions I haven't answered. I do beg your pardon about that. I'm just waiting for... Right, we've just got some people are chatting away in the chat room here. I'll just wait and see what comes back from that, and then we'll carry on. So just a very quick sort of, I think we're coming up to the end of the webinar now, and like I said, we will be holding some more webinars in the future, so if you want any information on those, again, info@igennus.com. If there have been any questions that haven't been answered, again, info@igennus.com, and you can refer some of the questions directly to me, Nina Bailey. Info on the products at shop@igennus.com, and we will be picking out some random winners for our books. Is That My Child? And ADHD, Natural Way to Treat It, by Professor Puri. So just a final thank you very much, everybody who's taken the time out this afternoon to participate in the webinar. And I'd just like to say many thanks to Robin Pauc. Thank you, Robin, very much indeed.
My pleasure.
Oh, lovely. Okay, and many thanks to you as well, Professor Puri.
It's been a pleasure. Thank you.
Lovely. Okay. And keep your eyes on the website, and we'll be posting details of our next webinar on that shortly. For now, I guess it's over and out. Okay. Bye-bye.